Hey everybody, welcome back. And today we are talking about calcium, right?
Talking about calcium.
Oh man,
Yep.
we bit off a little more than we could chew on this one.
Mm-hmm.
This is a huge topic, huge.
Yep.
So we're gonna do it in pieces. And so, anyways, in case you haven't met us, you're new to us. I am Dr. Smith, and I do family medicine here in Lawrence, Kansas. My clinic is Accomplished Health and Wellness, and if you're watching on my Facebook page, I bet you knew that.
Right.
And this is Heather Fiore. And one day we're going to figure out how to cross post onto Free State Nutrition. That's what her business is, Free State Nutrition, here in Lawrence, Kansas. And then you can watch on her Facebook.
Yay. It's a dream.
We're going to get there. So anyways, calcium. And right. I didn't have some tea, but you know what? My mom the other day, she was like, oh, I got a bag of tea for you that somebody gave me, and it's for your tea time. So I haven't picked it up yet. So, but we'll have to try it. I don't know if it'll be good or not. Anyways, calcium.
Yeah.
We're going to talk about calcium today.
Yeah.
So calcium is one of the most abundant minerals in the body. Wow. It's like everywhere.
Yeah. Let's talk about like what does it do? Like everything pretty much.
It does. Oh my gosh. The interesting thing is that calcium is really tightly regulated in the blood. Mm-hmm. And it doesn't really fluctuate that much when you eat, regardless of how much you're eating, because it's so tightly regulated. And the body actually uses the bone tissue as a reservoir and a source for your calcium. So that's how it's so tightly regulated. Got it. And so that's because your body wants to maintain those constant concentrations in your blood, because that's important. In your blood, your muscles, and your intracellular fluid. But you know what the interesting thing is that the calcium in your blood and your intracellular fluid and your muscles and everything, and the way it's used is only accounts for like 1% of the total calcium in your body.
Wow.
Isn't that crazy?
Because the rest is in your bones? Bone and teeth.
Oh, teeth, right. Yeah. It's like stored there, and it's used for your teeth, the teeth and your and your bones. For their structure and function. Yeah. So 1%. That's crazy.
It is.
You know what's crazy is that your body like leaches out that calcium, as you're getting older. And of course you're not taking in as much, and you're not doing a lot of those impact exercises either. Mm-hmm. But it's kind of crazy to think that can create this it's all of them put together, but creates the osteoporosis.
Right.
So anyways, back to what you asked. What does it do?
What does it do? It's all over the place.
It is.
What's it doing there?
So it helps us with muscle function. So like your contractions and everything. It also helps with vasodilation and vasoconstriction. So that's like the widening and narrowing of your blood vessels. Mm-hmm. It helps with nerve transmission, and then also intracellular signaling and hormone secretion. Does a lot of stuff.
Yeah.
It's involved in
that's big stuff.
So where can you get it?
Where can you get calcium?
Like, indeed. What's it found in, just in general?
Right. Mostly we think of dairy, right?
Right. Yeah, foods, right? But then you can also get supplements too, right?
Yeah. Yeah. This is where we kind of decided like supplements is like a whole ball of wax.
Oh man. You can also get calcium in your medications. So you kind of have to watch that too. There's so many places.
Like kind of a weird one that sort of straddles both of those is Tums, right? Like some people take Tums just as a calcium supplement. Right. Other people take it for like, acid reflux.
Yeah.
So I don't know, can you get both at the same time? Or does it like, if you're having reflux, is it like doing its job to fix your reflux?
Oh, I think, yeah.
But it's also contributing to bone health?
Yeah, because really like when it's fixing your reflux, it's actually just lowering the acid level in your stomach. Mm-hmm.
But then it can do its thing.
Then the calcium can be absorbed. Yeah.
Cool.
Yeah, so you're doing both. And that's what they do in pregnancy.
Yeah.
Yeah. Take the Tums. Yep. So, so if you're not taking in the calcium, then enough calcium, then what will happen is your bone actually will undergo breakdown. So anyways, on a daily basis, your bone is going to undergo growth and breakdown, reformation and breakdown. And that's because because of just all the stuff that we do, and it keeps your bone strong. And so if you're not taking in enough calcium, then you're going to be breaking down your bones more. But the interesting thing is that so when you're a kid,
did you just point yourself? Are you the kid?
I am so not a kid. I just had a birthday.
Oh, I didn't know.
Yeah, I did. I went over the hill.
Oh,
or I'm at the top of the hill. I don't know.
You're winning. Whatever is happening.
Yeah, I'm still alive.
That's right.
I'm like not 8 feet under.
Okay.
So anyways, when you're a kid and like teenager, adolescent, you actually have more formation of bone than you do breakdown. Right?
Sure.
But then, and then when you're like early middle adult, it's equal. It's about equal.
Okay.
And then once you go over like postmenopausal and over 65, then your bone breakdown actually exceeds your formation.
Right.
Yeah. So you need calcium levels differently at those different times, right?
Okay.
So
is that like just on average, or everybody's bone is going
that's pretty much the way it is.
You can't like stop the process. Okay. All right.
No. Do you know what you need at the different ages? Calcium wise.
How much? Sure. Yeah.
What do you need?
Well, so for little kids, for like toddlers, it's 700 milligrams, which is like roughly like 2 cups of milk. Okay, which is often, what we say when your baby starts drinking whole milk. The recommendation is 2 cups, which is big transition, right? Because a lot of times
they're like,
they've been taking
24 to 32 ounces,
taking all these bottles of formula or nursing a lot, and they only need 2 cups.
Yeah.
Then you have the young kids of like 4 to 8, and they need about 1,000 milligrams, which is like 3 cups of milk or 2 plus some other stuff, yogurt, cheese, other items that we'll get into. Then you've got your preteens and your teenagers. They have the highest needs, and that's about 1,300 milligrams. So a good 4 cups of milk.
I find it interesting that if you're pregnant or lactating, that it's the same as your preteen and your teens.
Makes sense, though, right?
Yep.
You definitely need a lot. I mean, you're pregnant, you're obviously like growing a human who has bones.
And then also when you're lactating, you're just like spilling it out,
right?
Giving it to your human that has bones that needs way more than you. Or well, I guess they don't need way more than you, but their bone formation is more than what you're doing.
And it's happening.
Yeah,
for sure. Yeah. But imagine a teenager who's pregnant or nursing.
Oh gosh.
Right? Like you just like cannot get enough calcium.
Yeah.
Like there's not.
They should be drinking more milk.
There's not too much calcium.
Or cheese or dairy or yogurt.
Right.
Yogurt has a lot. I was noticing.
It can. It really. I mean, gosh, there's such a variation.
That's true.
Depends.
Yeah.
But it can for sure. And then adults need about like 1,000 milligrams.
Yeah.
So
I think it's interesting because like when you're 51 to 70, the men need 1,000 and the women need 1,200. And then when you go over 71, you both need 1,200.
Yes.
So, but that's probably hormone fluctuation, I would say.
Yeah.
Because you become postmenopausal during that time and men don't.
Right. Darn, is right.
So when you're a baby, though, you need it seems kind of small. So the first 6 months of life, you need 200 milligrams a day, and the next 6 months of your life, it's only 260, and then it jumps up. Once you turn 1, it's like, boom! Now I'm growing, and I'm taking off like a weed, and I need 700.
I know.
It's like more than double.
It's more than double, but yet they're taking in a lot less, milk, so to speak.
Right. That's because they're eating that cheese and yogurt.
Maybe.
My son eats that like a crazy person.
Is that right?
Yeah, he
Cheese and
loves
yogurt.
cheese and yogurt. He's always
delicious.
wanting yogurt. Yeah, he wants yogurt. So my kids kind of got this completely opposite of it. My kids, but it's on the subject of yogurt. So they like those flip things.
Oh my gosh, my daughter is
Those
all
are
about
expensive,
those.
though.
Expensive and such a waste of plastic.
Oh my gosh! Yeah,
I really have a
my
hard
gosh.
time with it.
I recycle that plastic. But
I mean, I do too.
anyways, so I was like, I could so make this flip, right? So
You
I do.
You do?
I do.
And
Yeah,
it's acceptable?
it's acceptable
Wow.
because my son loves chocolate,
Uh-huh.
and so he gets chocolate chips.
Nice.
And Dylan's had them on sale, chocolate chips, bags of chocolate chips, different kinds, all kinds, for 75 cents a bag. It was crazy. I was like,
Really?
are they insane? So I bought a bunch of bags. And so he gets to go to the cabinet and he gets to pick out his chocolate chips that he wants that day. And then
Cool.
he always puts the handful into the bowl.
Mhm.
And then he goes, me eat, mommy. Me eat one, mommy. And so he has to reach his little hand in and get one and then eat it. I'm like,
Cute.
buddy, there's one right there in the bowl. No,
No, get out of
Mommy.
the
It
extra
has
one.
to be out of the back. Yeah.
Totally.
So anyways, yeah, it's kind of
Okay.
crazy. So, I don't know where we were.
So we were talking about how much we need.
Oh yeah.
So I don't know. So we covered all the age groups.
Yeah.
Pretty variable.
We could
Over the
talk
course of
about
life.
like the at-risk groups.
Okay. Yeah. So in addition to just like blanket,
Like
here's
this
the
is just what we
population,
need.
who are people that might need
Yeah.
more.
So it's not really all that surprising, but
Mhm.
boys and girls between 9 and 13.
Because their
when
needs are
pu-
so high.
Yeah, and if you think about it, that's when they're going to have a growth spurt before puberty happens.
Right.
So that makes sense.
Right.
And then-
Especially girls, right? Because they're going to have that growth spurt and then puberty and
And
then
then-
they're like all done growing. So
Yeah.
like, get your calcium,
Get that
your potential in there.
calcium. Yeah.
Yeah.
And then girls from 14 to 18,
Mhm.
and then women from 51 to 70. And that's again, like 14 to 18 is going to be your puberty years.
Mhm.
And then that 50 to 70, that's going to be your postmenopausal years.
Right.
And that's when you're losing that hormone. So you're not, and if you're not active, because you've lost your hormones now, you're not stimulating bone growth. And so that's when your bone,
You're losing it basically.
your bone loss becomes more than your growth.
Yeah,
And so you need more calcium to kind of build that up.
absolutely.
And then everyone over 70,
Everyone.
we all need extra. Those
Right.
are
Well, I mean, that's when people start eating less, right? They feel
Right.
like they don't
Well-
need as much food, and to some
Mhm.
degree it's true, but you still need all those nutrients,
right.
and so.
Well, and then they all get constipated too.
Mhm.
And so then they don't want to eat it either.
Right.
Yeah.
Right. And then, so the other thing about like the teenage years is like, when, even though kids may not be growing as much, doesn't your bone density like double in your teen years?
Yeah.
So like, I always
It's like
explain it like,
it goes it's like constantly increasing
Mhm.
until you're 30.
right. Is it 30?
It's like
Oh, I
you
thought it was
reach
25.
your
Awesome.
max bone density is at 30.
Is it 30?
Yeah.
So this is like putting money in the bank,
Right.
right? Like you
That
get your
calcium.
calcium, it's going in the bank. The rest of the time, like the rest of your adult years, you're really just trying to like maintain that, level. But that, you've got an opportunity to sort of maximize your bone density.
Yeah.
Those bones are carrying you around. You're literally carrying you around your whole
And your
life.
teeth.
And your teeth.
Yeah.
So,
But then you
Mhm.
also you have to remember that not only are you maximizing your bone mineral density, but
Mm-hmm.
you're also creating those stores for all the other functions.
Mhm.
Because really that's where it comes from.
Okay.
Is
Right.
your
It's going to
bone.
pull from
Yeah.
those stores. All.
Yeah, that
whole
1%, but 1%
Yeah.
can be big. Yeah.
Yeah.
So anyways, yeah. So I also thought that it was interesting that only about 30% of your calcium in your food is absorbed.
Wow.
Yeah, that's kind of crazy actually. And there's a lot of factors that influence how much is absorbed, right? So because you can only take in so much at a time.
That is true, and that's important for people with supplements. And we're gonna talk more about supplements, but it's hard to not bring it up.
Yeah.
But you can't absorb more than 500 milligrams at a time.
Right.
So that's a lot to get from food at once, but it's not a lot to get from supplements. And a lot of times people think, oh, let me just take care of it all in the morning because I'm not going to remember later. But you're not really doing yourself any favors to take more than 500 at a time.
Yeah, because once you go over 500, your absorption is less.
Mm-hmm.
You're not doing anything for you.
Might get constipated though.
Oh yeah, you are going to do that for you. The other thing is that this I think is so fascinating. But so when you're little and you're growing and you're growing and you're growing. So when you're little, like infants and young kids, they actually will absorb 60% of their calcium that they take in. But then once you get into like that adulthood, then it's like down to 20 to 30%.
Interesting.
That's kind of sad, actually. That just goes to show you that we become a little bit less efficient.
Efficient, yes. not just a little.
A lot less.
Yeah.
60 to it's like half.
Wow.
The efficiency. I guess we're doing other stuff for ourselves because
That's right.
we're like brain power then.
Sure.
Or we're just like running around after our kids.
Yeah.
But
the RDA should take that into account, right? Like we're saying you need, 1,000 milligrams, not times 3, like
right. No, like that's what you need.
That's what you need in order to get the amount that you're going to absorb.
Yeah. And like when you're looking at your labels, that actually is elemental calcium, right?
Mm-hmm.
Yeah.
Mm-hmm.
That's true. But sometimes they don't. Like I looked at my yogurt this morning because we were talking about this, and actually my yogurt container said 35%.
Really?
Yeah, it didn't have a number. It said 35%. So I was assuming that meant 35% of your daily amount.
Right, which is probably 1,000.
Yeah.
Mm-hmm.
So you can do the math. But
especially because 1,000, that's nice and easy.
Yeah, that is easy. Super easy. Yes, so we'll kind of like go into that elemental calcium probably next time, I think, when we talk about the supplements, because that really goes a little bit more into supplements, right?
For sure.
Okay. So also, like, before we talk about foods, we also have to, because there's things that will change the way you absorb your calcium as well, like vitamin D, right?
Yeah.
So
definitely need to have your vitamin D along with your calcium. You need to have vitamin D.
Yeah.
It's fat soluble, so you don't have to have it like right then that minute, but you have to have it.
But you have to have it in order to absorb your calcium. You have to have enough vitamin D in your system to absorb it. And that can also come from sun, right? So sun and your food.
Right.
But you just have to have it. But then that there's some stuff in your food that can bind up your calcium and inhibit your absorption, right?
Yeah, there's there's certain things like oxalic acid that are like in spinach or like leafy greens, and we sometimes think we're going to get our calcium from those foods, but it's not absorbed very well, like worse than other foods. So
like spinach.
Yeah.
I changed over to spinach because I think that that lettuce is crunchy water.
Now, all lettuce, not just iceberg. Iceberg is crunchy water.
Yeah. Not all lettuce. I mean, I throw in some of the romaine and other stuff, but the leafy lettuce. But usually I do spinach just for that. Really, I do it mainly for the iron because of being a menstruating woman. You want to make sure you have enough iron in your system. So.
Sure.
So then I was thinking, I should probably drink 2 glasses of milk.
Maybe so.
Because the phytic acid and I think
might interfere with the milk also. It's hard to say, or is it just all tied up together with the calcium that's in the spinach? Or does it interfere with the other foods you're eating at the same time?
Has anyone studied that? I don't think so. But it still can decrease that absorption, right?
It can a little bit, for sure.
So,
yeah. So we've talked about iron too. Like iron can interfere with calcium too.
It does.
They bind to the same receptor, so you could just
I'm just telling you everything.
Complicated.
Everything. Yes.
And I think coffee, right? Like caffeine, doesn't caffeine interfere with
it does. Caffeine will increase your calcium excretion and decrease your calcium absorption.
That is so rude.
So, right? It's like kicking more out,
double
and I'm
whammy.
blocking. Yeah, you are not taking any in when you're drinking your coffee. And tea. Actually, tea was in there too.
Drag.
Yeah. Yeah. Alcohol too. That's our other friend, because we've talked about wine and stuff. Alcohol decreases your absorption too by inhibiting enzymes in the liver that convert vitamin D to its active form. Wow. So that actually does a double whammy on that one too, because it changes it doesn't allow you to change your vitamin D and absorb your calcium.
It's rough. How are we even living?
So don't drink your coffee after the alcohol puts you to sleep, because you're not going to be absorbing any of that calcium that was in the cheese in your nachos appetizer.
Because that's why we eat nachos, to make sure we get enough calcium.
Yeah. And because and then there's protein actually too. So the more protein you take in, which a lot of people are on that keto. Yeah, I think about keto diet.
So there's a level, right? Adequate protein allows you to absorb calcium properly, but way too much protein interferes. Is that how it works?
Yeah, and it increases the excretion of your calcium, but it also increases the absorption in your gut. So who knows? Maybe it balances itself out.
Yeah,
when you do protein, maybe. Right.
I think there is a limit, though.
There's definitely a limit. I mean, we've already talked about that with the keto diet. Yeah, it's a limit. And then sodium. Sodium also plays a role. Sodium and protein intake. The more sodium intake you have, it increases your urinary calcium excretion.
Right. That's that whole electrolyte balance business that our bodies are always doing.
Always. Yeah. And so I guess we should talk about how it's eliminated. So we lose it in our sweat when you're up in front of people or running or, whatever you're doing that's making you sweaty. Also in your poop, our feces, we lose it that way. And also in our urine, we lose it every way we possibly can.
Okay.
Yeah. And, we don't really lose it in our bones. We store it there.
Right.
But I'm just saying. Poop, urine, sweat. Those are really all the ways you could ever possibly lose it anyway. I guess if you vomited. But we don't do that every day. Hopefully you poop every day. That's a good bowel movement regimen. But then fruits and vegetables, that's the other one. Who knows if I don't know. I don't know how much it really, does it affect it a lot, fruits and vegetables? If you have a high fruit and vegetable diet, will that change things?
With your absorption, how much you absorb calcium?
Yeah.
I don't think so.
Because
other than the oxalic acid.
Yeah. Well, and so I was reading that it can actually shift your acid-base balance and make it more alkaline by producing bicarbonate. And then that will decrease your calcium excretion with your fruits and vegetables. So,
interesting.
Yeah, so I don't know.
I don't know either.
So maybe it's better. But, yeah, I don't know. Metabolic acids that are produced by a diet high in protein and cereal grains can increase your excretion too.
So is all this taken into account when we say you're only absorbing 30% of what you eat? Is that because of all these factors, or is that just because of internal factors?
Well, I think yes.
Okay.
But then I think you can affect them further with this stuff.
I see.
Because we aren't all drinking alcohol. But when we do, then we're not really helping our bones.
Got it.
And our hormones.
Yeah.
Everything. Teeth. Everything. So what foods can we get it from?
Okay, so hopefully you're going to get your calcium from food.
Right.
We're going to talk about supplements
next time
next
because it's too
time.
big of a topic.
Yeah, it's like a whole ball of wax there.
Yeah.
But spoiler alert, we're going to tell you that it's better to get it from food. Okay?
Yeah, that is a big spoiler alert.
So,
But just so that you tune in, we're also going to talk about like how calcium supplementation and just calcium from your diet affects different disease processes too. So just because we spoiled that part doesn't mean you don't get to tune in.
Right, we'll have lots of other important things to say.
Yeah,
for sure. So here's how you get it from food. Dairy products are obviously the most concentrated source, right? That's going to be the most obvious and easiest way to get calcium. If you drink milk, awesome. Drink that, and we're shooting for 1,000 milligrams for most adults. 3 cups of milk would do the trick. But you could also have, 3 servings of dairy where only one of them is milk and one of them is yogurt and one of them is cheese.
I love cheese.
Yeah, who doesn't love cheese? Cheese is delicious. So, you can get it from those things. Milk has the most concentrated amount. But apparently yogurt sometimes does. It depends how much you eat. I mean, sometimes when people eat yogurt, they don't necessarily have a cup anymore. People only have like less than a cup. And then obviously you're going to get less calcium.
Yeah.
And then cheese, you have to have more than an ounce. Like an ounce might only have, 15 or 20% of your calcium versus a cup of milk is going to have 30.
We're cheese addicts in our house, so we
probably
usually
good.
have more.
Yeah, most people don't have a problem going beyond an ounce of cheese. And then, so beyond dairy, there's dairy substitutes, of course, like, we've talked about soy milk and almond milk and all those guys, and they may or may not be fortified with calcium, but also vitamin D, because vitamin D is added to milk.
Right.
And inconsistently added to yogurt and cheese. Also,
did you know that it's also inconsistently added to milk? There was this
really?
Yeah, when I was in residency, there was this study that had just come out, and it was specifically looking at the vitamin D amount in milk because of the dietary recommendations for kids. And should we be supplementing our kids with vitamin D? And what they found was that depending on where you are in the vat, the milk, gallons of milk will contain more or less than what they really actually say. Yeah,
that's terrible.
So they need to be like, and maybe they have come up with this solution. They need to be mixing up the vats before filling the jugs. Maybe they've come up with that.
Maybe they figured it out.
I don't know, but it did seem to be, I believe, more consistent in the vitamin D milk. Because it's fatty. It's a little bit fattier. I don't know.
Maybe it doesn't separate out as easily.
Yeah. So anyways,
that's
interesting.
That was
interesting. Yeah,
for sure. Yeah. So those are places you can get your calcium. And then, we already mentioned that there are some vegetables like leafy greens and broccoli. A lot of times people say, oh, I don't eat dairy, but I eat lots of broccoli. You have to eat like 5 cups.
That's like a whole plate full.
It's a whole lot of broccoli to get your...
That's like
And that would be like every day. Like who eats... I mean, okay, maybe you do eat a lot of the broccoli when you eat it, but do you eat it every day?
Indigestion.
But maybe you get used to it.
That's true. But that would be like replacing your noodles with like your broccoli instead. Like it's a whole plate.
It's a whole plate.
That's a lot of broccoli.
It's a lot.
That would be expensive.
I mean, I'm just saying, like maybe you do that. Maybe you just love broccoli. So when you make it, you make a lot, but you're not going to do it consistently. No. So you're probably not going to get your calcium because you need it every day.
Right. Yeah.
So
I'm finding that I'm worried. Maybe I'm not getting enough.
It's a concern.
Yeah.
But I don't know. With the cheese, you might be all right.
That's true. I do like cheese. Is it found in chocolate?
No. Even milk chocolate, like no. Sorry. But so fatty fish, like with bones, like soft bones that you can
Nobody
eat.
eats the bones.
Some people do. Like if
Who
you
eats the bones? If
I'm
you
just-
eat the bones of your fish, you let us know.
I'm just
Because I'm
saying
interested.
like sardines. Okay, back to sardines. There are people who eat these things. And if you do, good for you, because you're getting your calcium as well as your omega-3s. It's great. And then sometimes salmon, like canned
like for
salmon,
fish.
will have.
I mean, that's for cats.
I'm just
Sardines.
saying, it's a thing. People eat it. It's Italian.
crunchy.
Little pasta.
Are they crunchy bones? I don't know.
I don't think so.
Salmon, like, I cannot stand it when my fish has bones in it. So really,
Right, I mean,
I'm
not like real bones, but like there are soft bones that are edible.
Yeah. But
Still good.
even so, like, I can't stand that. So you're not getting your calcium if you don't eat the bones.
That's right.
Oh.
Yeah. I don't know offhand how much like the salmon itself has calcium.
What about
Probably
if
not
you what about this? If you crack your eggshell in and you get some eggshell in there.
I don't.
I hate that too.
I know. That's
Like,
way worse than a bone, I think.
the
Yeah.
crunchiness when it's supposed to be soft.
Yes.
Not right.
I don't know that you can pull calcium from an eggshell. Maybe
You can.
You can, huh?
Yes.
I don't recommend it. I'll say
You
that.
you actually right. So you can crunch up your eggshells, dry them, and then crunch them up, and you can actually spread them in your garden, and it
Mhm.
helps to add calcium in there. But you can also give them. You can put them back into your chicken feed,
Mhm.
and it'll make their eggs stronger. The problem is though, is that they might get a taste for eggs, and then they might want to eat their own eggshells.
Which
Which
seems problematic. So other places besides eggshells that you might get calcium would be like fortified foods. And so like orange juice will have calcium
I
added
don't drink that much.
sometimes. Right. I mean, yeah. If you already
we've
drink
kind of
orange
like
juice.
blasted juice, you know. Now I'm down to like this much juice, like a shot of juice. Like,
Right. So you could get like a little bit if you
Yeah.
got the calcium, if
I
you
don't
needed
know.
it. Sometimes it's added to cereal or
Yeah,
like,
that's true.
granola bars might have like 10 or 15%. Like, I mean, if you're really wondering about your calcium intake and you're not a milk drinker, these are things to look at in your diet. Like maybe a little 10 or 15% here and there could add up and I could be all right.
So
Yeah.
what we're saying is
I'm saying if you don't drink milk, you should pay more attention to your calcium intake.
I bet there's an app for that.
Yeah, of course.
There's like a calcium adding app. What was I going to say? There was something about vegans.
Mm-hmm.
Would they have because they're not eating dairy,
Right.
They're not eating any byproducts. So would they have more trouble getting calcium since it's not as high in the?
I mean, I would
vegetables and
recommend
stuff?
a dairy substitute like soy milk
Okay.
or, another milk substitute.
I hate that.
People calling. Busy here. Yeah, so for vegans, that would be what I would recommend is like, some sort of, milk substitute.
Okay.
Yeah.
So
I feel like, we could go on.
Oh
like,
my gosh,
But
yeah.
let's not. Let's talk about
Right.
the
What happens-
pros and cons of supplements next time.
yes. Let's like really quickly go over what happens if you're too high and what happens if you're too low.
Okay.
Does that work?
Sure.
So really there's
I have a question though.
yeah.
Can you get too high or low from food? Or is it mostly like when you're taking supplements?
No. You can get too low if your diet is too low in it.
Okay.
But really there's actually no short-term consequences of being too low. Because your body, your blood keeps it so your body keeps your blood calcium so tightly regulated
Right.
that you're not really going to see much if you're low.
Mhm.
Long term, though, you can see a decrease in your bone mineral density, and that's going to obviously increase your risk of fracture.
Sure.
So, that's really the biggest thing. Usually when we see low calcium, it has to do with medical problems or medications.
Mm-hmm.
So really low, which we call hypocalcemia, that means low. Hypo, remember that's low. Calcemia, calc is calcium, and emia is blood. Low calcium in your blood. We don't really see that unless it's like medication induced or some kind of disease process.
Got it.
So that's good, right? So the opposite of hypo is hyper, right? That's too high. High in your. So you can get high in your blood with supplements, but not usually with diet. Okay.
That's interesting.
Yeah. So we're going to talk on that later. And you can, but usually actually when we see hypercalcemia, it's usually hyperparathyroidism that's doing it, or cancer.
Nice.
The two bad ones, hyperparathyroidism and cancer. That's usually when we see really high levels of calcium. Okay. Otherwise, it's not really that high. And what can it cause? So it causes constipation, which we talked about already. High calcium can cause renal insufficiency, which renal is your kidneys. That means your kidneys aren't working very well. It causes calcium deposition in your vascular system, so in your blood vessels, and also in your soft tissues. So that's, like breast cancer, when you're going for your mammogram and they see calcifications, that's why they go looking for that a little bit. Like they'll do more imaging when they see calcium deposits in the breast, because it can be linked to breast cancer. Can be. Doesn't always mean is, but can be. That's why they do more imaging. Okay. And then also it'll lead to high levels in your urine. High levels in your urine can lead to kidney stones. Yes. And that is mainly seen with supplementation, not food.
Right.
We don't usually see kidney stones with food, but we do see it with supplementation.
Yeah, I think that's really important for people to realize. Like, you don't need to stop drinking milk or getting calcium if you have kidney stones or history of it.
Do you know, actually, a lot of times when you have kidney stones, we tell you to increase your calcium in your diet, not supplementation. Diet, because supplementation is going to cause kidney stones, but in your diet it won't. So anyways, so there we go. Now we've talked about it. Now next time we're going to talk more and more and more and more and more about calcium supplementation, what kinds are out there and what can they do to you, which we already kind of talked about, we touched on. So we're going to go much more in depth than that. And you're going to be intrigued and surprised all at the same time.
Yes.
So thanks for joining us today. And next time, like I said, we're going to continue on calcium number 2. And it's going to be more disease processes and the supplementation and what you should and shouldn't be doing. And if you have any questions or you like to eat fish bones, you just let us know.
We want to hear about it.
And if you have some topic that you want us to talk about, also let us know on that too. But we're not going to talk about fish bones anymore. Okay. You guys have a great day, and we will see you next week. On Tuesday, right?
Tuesday.
Yep. Tuesday. Have a good day. Bye.